Well, this is Corona 7. It's the seventh of the series about Corona, and I'll just read it out. It's the 9th of April, and I've just been watching the latest update by Dominic Raab. He's deputising for the Prime Minister Boris Johnson, who's recovering from Corona flu, and he was supported by the Chief Medical Officer, Professor Chris Whitty, and by Sir Patrick Vallance. Professor Whitty is an epidemiologist and the Department of Health's top science advisor. He's also a consultant at the Hospital for Tropical Diseases. And Sir Patrick Vallance is the government's chief science advisor. He was president of research and development at the multinational pharmaceutical company GlaxoSmithKline. The latest UK statistics are 7,978 hospital deaths and about 61,000 identified cases. This is April the 9th. As these figures do not include cases and deaths outside hospitals, the number will be considerably higher, and it's very worrying for a man of my age. 89% of deaths have been in the over 60s, and 50% of the deaths have been in the over 80s. And whilst these numbers are worrying, I think to put these numbers into perspective, this is the table from the Department of Health and Social Service Coronavirus Action Plan, a guide to what you can expect across the UK, which was published on the 3rd of March this year. And the relevant column is the estimated attributable excess mortality in the United Kingdom. The first of them is Spanish flu, which was 1918 to 19, and 200,000 in the United Kingdom died from Spanish flu. And just moving down, Asian flu, which was in 1957 to 1958, 33,000 deaths, excess deaths, were attributable to Asian flu. But even worse, 80,000 deaths were attributable to Hong Kong flu, which was in 1968 to 1969. So we have a long way to go before we reach that. Moving further down, swine flu was a relatively mild flu. Only 457 died from that. And in Middle East respiratory syndrome in 2012, we had no deaths. Most of the deaths were in fact in Saudi Arabia. And we come down to this serious acute respiratory syndrome, or SARS. It was a coronavirus. And again, nothing. Then we had a severe coronavirus pandemic, near miss as they call it, and there's no statistics there for it at all. But in the seasonal flu epidemic in 1989 to 1990, there were 26 excess deaths in England and Wales. There's a very noticeable absence from this table, and that's the 2014-15 figures. 34,500 died from winter flu in the United Kingdom. and it's not very long ago. But in none of those epidemics which I've mentioned there did we have this lockdown business. And its catastrophic effect on people's lives and jobs, stock market, you name it. Mental health, physical health. And the world numbers for corona on the 9th of April are 90,694 deaths and 1,510,419,000 identified cases. So the deaths from coronavirus have a long way to go before they reach the numbers I've just mentioned. So I thought it would be useful just to have a look at the timeline for all of this, how we came to be in this current situation. And it started seemingly on the 31st of December, when China alerted the World Health Organization about a spate of pneumonia-like cases in Wuhan. And then on the 1st of January, the seafood and animal market, believed to be at the centre of the outbreak, it was closed. On the 9th of January, just over a week later, the World Health Organization says the infection is caused by a new type of coronavirus. 2 days later, on the 11th of January, the first death was confirmed. Another 2 days later, on the 13th of January, there was a suspected case in Thailand, which was the first case outside China. And on the 16th of January, a case was reported or confirmed in Japan. And a day later, there was a second death of a 69-year-old in Wuhan. And on the 20th of January, the number of cases triples to more than 200 in China, and the outbreak spreads to Beijing, Shenzhen and Shanghai. And a third death is confirmed, and the Chinese confirm human-to-human transmission. It's reported that the Chinese try to cover this up, try to hide it. But a Chinese doctor working in the Chinese health service, he informed the world about the dangers of this new virus. And he did in fact subsequently die from it, which was dreadful. And on the 20th of January, even before any cases were reported in Taiwan, which is an island off the coast of China with a population of 22 million, they set up an epidemic control centre. And when the disease reached Taiwan, which was very popular with Chinese tourists, quarantine measures were introduced for those identified as having corona, together with any close contacts. And then on the 20th of January, the first case was reported in South Korea, which has a population of 51 million, not far from our population in the United Kingdom. On the 21st of January, the United States authorities announced their first case in North America, and it was a man who had been to Wuhan on business. And then 10 days later, 31st of January, the first 2 cases of corona flu were reported in the United Kingdom. On the 22nd of February, there was a huge rise in coronavirus cases in South Korea as the outbreak spread. It seemed to have spread from just one church and one person. And in South Korea, the Prime Minister Chung Se-kyun, he opened a government meeting on the health emergency by saying, "We have entered an emergency phase. Our efforts until now had been focused on blocking the illness from entering the country, but we will now shift the focus on preventing the illness from spreading further in local communities." And the following day, on the 23rd, South Korea's president said on Sunday he was putting the country on red alert due to the rapid rise in new cases, which are largely being traced back to church services. Health officials reported 169 new infections, bringing the total to 602, having doubled from Friday to Saturday. They adopt an aggressive policy combined with contact tracing. They interviewed people who had the disease, and they set about tracing only people they'd been in close contact with. And they used extensive use of new technology and CCTV, mobile phone data and credit card transactions, etc. And those identified as having the disease or having close contact with the sufferer, they were put into quarantine with severe penalties if they broke it. But South Korea, they did not resort to a full lockdown. And the results were very successful so far, with many fewer sufferers and deaths than comparable countries such as Italy and Spain, for instance. On March the 3rd, the United Kingdom Department of Health and Social Care published the government's action plan. And in this report is this belter of a statement. Given where we are now, the United Kingdom is well prepared for disease outbreaks, having responded to a wide range of infectious disease outbreaks in the recent past, and having undertaken significant preparedness work for an influenza pandemic for well over a decade. For example, our existing flu plans, well, when you click on this link, it takes you to the 2011 UK Influenza Preparedness Strategy. It doesn't actually take you to the later one, the 2017 policy for some reason, which I looked at in an earlier video. And they go on to say, our plans have been regularly tested and updated locally and nationally to ensure that they are fit for purpose. That's a great, hell of a sentence, that. This experience provides the basis for an effective response to COVID-19, which can be tailored as more specific information emerges about the virus. And then going on, these plans ensure the United Kingdom is equipped to deliver a coordinated multi-agency response to minimise wider societal impact that could arise from a significant outbreak. An effective response also requires the active participation of a well-informed public and all service providers. Planning draws on the idea of a reasonable worst case scenario. This is not a forecast of what is most likely to happen, but will ensure that we are ready to respond to a range of scenarios. Well, nothing you can say to that, really. They weren't prepared for it at all. On March the 3rd, Sue Pollard in the Daily Express reported, and I've outlined it in red because I think it's important, the worst case models show that 80% of the population may get the virus, which would mean, based on the death rates seen so far elsewhere, up to 500,000 deaths in the United Kingdom. Looking at the global figures, Professor Neil Ferguson of Imperial College London has calculated, and there's a quote, with an enormous amount of uncertainty, it's an understatement, that 1% of those infected might die, with a fourfold margin of error in each direction. A death rate of 0.25% would be similar to the 1957 and 1968 influenza pandemics, which killed at least 1 million people, that's worldwide. A 4% rate would compare with the 1918 Spanish flu epidemic, with a devastating death toll estimated at 40 to 50 million. And then she goes on to say, it is vital that we do not panic, not least because it would be pointless. On that note, this organisation, UKRI, on March the 31st said this: media stories that employ the language of panic and of panic buying more specifically are actively harmful. They help create the very phenomenon that they purport to condemn. Yeah, but it sells newspapers. They help create the selfishness and competitiveness that turns sensible preparations into dysfunctional purchase of a year's supply of toilet rolls. And I'll look at that in another video, I think. And then on March the 11th, the World Health Organization declared the outbreak of the coronavirus a pandemic, which it defines as a global spread of a new disease. On March the 13th, this was an important day, the government adopts a strategy of waiting until coronavirus is peaking before closing schools and asking vulnerable people to stay at home. In other words, it was a request. The United Kingdom's Chief Scientific Advisor, Patrick Vallance, said the government strategy is aimed at creating a herd immunity to the disease. The herd immunity strategy was where people who had the disease, but not necessarily seriously, and any person they'd come into close contact with would sort of self-isolate for a couple of weeks. And then gradually the number of people who were immune to the disease, having had it, would build up in the population until it reached a level where the coronavirus found it very difficult to find sort of new people to infect. And there would be a rapid fall in the numbers of people who contracted the disease. A former World Health Organization director has attacked the government's herd immunity strategy. Anthony Costello, Professor of International Child Health and Director of the University College London Institute for Global Health, questioned the tactics. He said on Twitter, "Doesn't this herd immunity strategy conflict with the World Health Organization policy?" After the announcement of this being a pandemic, Dr. Tedros, Director General of the World Health Organization, said, "The idea that countries should shift from containment to mitigation is wrong and dangerous." By March the 14th, 10 more people in the United Kingdom have died in the last 24 hours after testing positive for coronavirus, bringing the total number of deaths to 21. It's moved on along since The United Kingdom government's chief medical advisor said the patients were all in at-risk groups from across England. It comes as Professor Chris Whitty, the United Government's Chief Medical Advisor, warned that the facilities for people needing oxygen and critical care beds would be the parts of the National Health Service that will come under pressure first as the scale of the outbreak increases. There is a desperate need for ventilators. British manufacturing companies are to be tasked with increasing the production of ventilators and other medical equipment, while the National Health Service could also buy up thousands of beds in private hospitals. In a conference call with manufacturers on Monday, Prime Minister Boris Johnson will urge them to join a national effort to tackle the virus. On the 17th of March, it was noted that Germany has 28,000 intensive care beds and 25,000 ventilators, with another 10,000 on the way. France has 5,000 ventilators and the United Kingdom has 8,000. And then on the 23rd of March came the big change. This was only 10 days after the first strategy. Based on the forecast of 250,000 deaths forecast by Imperial College in London, the government orders a lockdown. The government's thinking had changed very quickly. It started off trying to contain coronavirus by isolating people who tested positive and asking anyone who had close contact with them to self-isolate too. Ministers then introduced policies to delay and reduce the peak when the most cases are expected. The idea was that by pushing it back into the summer, it would allow the National Health Service to cope. But modelling from Imperial College London prompted a change in approach. It warned the policy of managed spread could lead to more than 250,000 deaths, with hospital intensive care units getting overwhelmed. This prompted a rush to legislation, and this brought in the current lockdown situation. A day after this change in government policy, on the 24th of March, an Oxford research group under the epidemiologist Sarita Gupta reports that their research presents a very different view of the epidemic to the modelling at Imperial College London, which has strongly influenced government policy. I am surprised that there has been such unqualified acceptance of the Imperial model, said Professor Gupta. And this Oxford report suggested only 20,000 or fewer deaths. Well, given what had happened, there was absolute consternation. Consternation reigns both within the government and the Imperial College team. They continued on this pathway. On March the 25th, the Coronavirus Act of 2020 was put before Parliament. But on March the 26th, only 2 days after the Oxford report, Professor Ferguson, he's the guy from Imperial College, quickly puts out a statement following Professor Gupta's report in which he drastically downgrades his estimate of 250,000 deaths. Later, he went on to say, "I think it would be helpful if I cleared up some confusion that has emerged in recent days. Some have interpreted my evidence to the United Kingdom Parliamentary Committee as indicating we have substantially revised our assessments of the potential mortality impact of COVID-19. This is not the case. Indeed, if anything, our latest estimates suggest that the virus is slightly more transmissible than we previously thought. Our lethality estimates remain unchanged." My evidence to Parliament referred to the deaths we assessed might occur in the United Kingdom in the presence of the very intensive social distancing and other public health interventions now in place. Without those controls, our assessment remains that the United Kingdom would see the scale of deaths reported in our study, namely up to 500,000. And on April the 9th, that's today, the lockdown continues for another 3 weeks, it was announced. And then a little bit which I've just added. I mean, once the United Kingdom had missed the opportunity for mass testing, such as they were doing in Taiwan and Korea and Singapore, and to name but three, I think Vietnam was another one, it was understandable that we had to try and minimise a large increase in cases needing hospital treatment, which would have just overwhelmed the National Health Service, it was manifestly unprepared for this pandemic. Large numbers would not have had the treatment they needed. In other words, you wouldn't be able to get into hospital, and many would have died. I mean, there would have been a question now: who are you going to let in, and who are you going to keep out? In other words, you've been playing God. The strategy was changed on the 13th of March and again on the 23rd of March, when the stringent lockdown began, and is set to continue for weeks to come. It has been announced tonight, that's the 9th of April, that whilst the number of cases is still rising, the rate at which it is increasing has slowed down, and the lockdown has been the main contributor to this. So they say. So far so good. Anyway, just to lighten the mood, a little Corona story which I found amusing. The old Desmond I was telling you about yesterday on the video, he lives in a really remote place. One of these spots where you drive past, you see a sort of entrance, there's a farm sign there, sort of high farm, and if you stop and have a look around, you can't see a house for miles. I mean, when his wife was alive, they used to do bed and breakfast. But to get to this spot, you needed a four-wheel drive with about 2 feet of clearance underneath. And that was when it was dry. He had a little grey Ferguson tractor, a little grey Fergie, and it had a sort of bucket attachment on the back. And once a week, he used to set off for the local auction mart. The dog used to sit in the bucket. And he'd drive down to the main road, and there was a little building there, put the tractor in there, and wait for the bus, which of course was free for old people. Or someone had come past who was on their way down into the town and give them a lift. I mean, some bloke came and offered him big money for this thing, so he sold it. he bought a somewhat battered Toyota pickup, and but again, he doesn't take it on the road because he runs it on red diesel. I mean, for those of you who don't know what red diesel is, it's diesel you don't pay tax on, so it's dirt cheap, but you're only allowed to use it for farm work. You're not allowed to use it on a public road unless you're sort of travelling from one field to another. I mean, now, if you get caught with red diesel in your tank on the public road, it's big trouble. I mean, but there are ways around it, but I mean, that's another story. So there's only him and his dog, and I think he has a few chickens, but the foxes keep making off with them. But he continues to go to the mart on Wednesdays. I mean, he just goes for the crack, really. And of course, they do a wonderful dinner there. But of course this coronavirus business has put paid to it all. So he's stuck up there all on his own. And rather than going to town just for provisions, because it's quite a long way, he decided he would put an order in, and of course by the miracle of modern technology, he has a mobile phone. So he rang up the supermarket and put his order in, which consisted mainly of booze, fags and tins of dog food. And at the end of it, the bloke on a supermarket said, is that it then? Oh, he said, do you deliver? He said, no, he said, we only do chicken, lamb and pork. Anyway, to continue. What I cannot understand is why, on the 23rd of March, the government were seemingly stampeded into a complete change of strategy, only 10 days after agreeing a policy aiming at creating a so-called herd immunity, as outlined by Sir Patrick Vallance on the 13th of March. On March the 25th, only 2 days later, they pushed through the stringent Coronavirus Act 2020 in double quick time. The available information is that the decision was made following a meeting with Professor Ferguson, at which he made a jaw-dropping projection of between 250,000 and 500,000 deaths if the herd immunity strategy was allowed to continue. I mean, this figure was already in the overarching government strategy to respond to pandemic influenza, published by the Cabinet Office on the 11th of January 2011, which was 9 years ago. And I think that the Imperial College team were the advisors to this Cabinet Office document. This table was on page 50 of that report, strategy document. The first column is the clinical attack rate, CAR, what proportion of the population will get the virus, and column 3 mentions deaths. In the least serious scenario considered, which was 25% CAR, the number of deaths was estimated to between 56 and 375,000. You can see it there on the table. In the most serious scenario, 50% CAR, which coronavirus had been assessed as by Professor Ferguson, the death rate was forecast to be between 111 and 750,000. You can see it there. If the government advisors had read this 2011 document, Ferguson's forecast of 500,000 deaths should have come as no surprise, given that it's well within the range for 50% CAR. Were they aware of this report? And had they read it? The observations would suggest they weren't, and they hadn't, which is disturbing, or worse. And this, the last little bit just explains why the Cabinet Office chose the CAR rates which they did, in red there at the bottom. Finally, we use 50% as the upper bound for the clinical attack rate because the World Health Organization has advised health departments to plan for a 50% attack rate as a worst case. Worrying. Very worrying. The downside to this is that there will be a large percentage of the population who've not had the virus. And nobody knows who they are, because we haven't been tested. And we aren't likely to be tested until May. So when the lockdown regulations are relaxed, they will provide, these people who haven't had the virus, who don't know who they are, will provide a reservoir for the virus to flare up again. In other words, you get these sort of secondary pandemics. And I've seen no plans for how they're going to deal with this. And the elderly will again be the most vulnerable. In other words, you might have got away with it during the lockdown, but you might not be very lucky in the subsequent waves, which always follow pandemics. We all need an answer to this, especially those at great risk of dying from the disease. But so far we haven't got one. And as far as I know, nobody's ever asked this question. And yet, for me, who is at great risk of dying from the disease, it's absolutely crucial. Will I be able to go back to normal once this lockdown has been lifted, because I've had the disease and am therefore immune, or not? I don't know, and it's a worry. What if the final death toll under this lockdown strategy, where you've got the main pandemic and then you've probably deaths in any subsequent sort of outbreaks, what if it's only marginally less than it would have been had we continued with the herd immunity strategy? Will it all have been worth it? Well, I have my point of view, and I'm sure you've got yours. Anyway, on that note, take care. We'll see you again. Bye-bye. I've just heard on the news that some health worker who had in Scotland has had a tyre slashed on a car, all four of them, because locals think that she's come in from outside. Absolutely horrendous. I mean, what these locals don't understand, or some of them don't understand anyway, this particular individual, that these people you're trying to keep out, they are the people who bring millions of pounds into your economy every year during the summertime. And a great many of them are not likely to forget how they've been treated. In fact, a great many of the people who might have been considering coming to places like Scotland and Cornwall and the Lake District, but have never actually been there, they might just change their mind, and your economy will suffer badly as a consequence. Think on.